Thank you, Mr. President. I appreciate the debate already beginning. I can see how it's going to work out. Look forward to a good debate. Courage. Courage. Much has been documented in history books about men having courage, especially valid documented war stories about men in the battlefield who were willing to sacrifice their own life to protect their own families, their own country. Many soldiers have died because of their bravery, and we thank all of those who have served or currently serve. Your courage is appreciated. Today, I want to talk about another kind of courage. Courage that is not just courageous, just a different type of courage, but equally bold. It is the courage of motherhood. My daddy always told me I was special. I was always a daddy's girl. He taught me hunting and fishing, competitiveness as an athlete, and most importantly, strength to endure anything. My mama always told me I was different. I could never figure it out. I bet y'all can't either. Why was my daddy so encouraging, but my mama not so much? She knew I was different. She had raised 5 kids and multiple grandchildren. She knew in her heart, Renee is different. My mother knew I was different than my sister. I knew when I became a teenager that my mama was right. She explained it to my dad. Renee has female trouble. Back then, you didn't talk about reproductive health like we are today. Just female trouble in the old South. And some of y'all probably say that now. It's just the way it was back then. When I was 18 years old, I had my first surgery to remove a ruptured ovarian cyst and also had a large, very large benign tumor on it. I had 2 subsequent abdominal surgeries. Then when I was just 22 years old, I had a total abdominal hysterectomy. I quit college. I was devastated. I was barren. The rest of my life lay before me as a woman with no children and no hope. And y'all know, everyone in here, how much I adore children. And it was my goal and my dream to become the best mother ever. The worst part lay before me, and I had no idea. I was going through menopause because I was not placed on hormone replacement therapy. I suffered depression. My hair fell out. I looked emaciated. I was only 25 years old, but I looked 50 years old. Fortunately, when I was 28 years old, I finally got help. I met an endocrinologist who took me off the roller coaster ride. He started me on hormone replacement therapy. And now, and I know I'm going to cry, and I'm sorry if I cry, and now the shining light at the end of the tunnel, and why I am passionately compelled to be pro-life, and why I have been a consistent advocate for more and better health care for women, unlike the health care that I had. I have seen courage eyeball to eyeball. It must rival any battlefield courage that men talk about. It is the ability of one mother to hand over their tiny, swaddled, brand new newborn and essentially let go, giving life to another mother. A mother who craves life, who is awaiting another heartbeat to cherish, to love, and give every ounce of energy for that newborn to have a better life. The adopted mother witnesses courage, strength, and dignity from the birth mother. Y'all know I'm going to cry when I talk about my kids. It is the story of Zach, whose name is Zechariah, and Rachel, who is Rahel. All of you know about them because you know they're the love of my life. Zach was a closed adoption. I never knew his 16-year-old mother who gave birth on an Air Force base. Zach was born for 4 weeks premature, had failure to thrive, and had low birth weight. Within a month of when I brought him back home, I had to take him back to Eggleston Hospital where he stayed for a while. A special needs child his whole life. I will never forget getting on the Delta plane. I cried for 4 hours home. And the pilot, everybody on the plane knew what was going on, that I was a newborn mother. And when I got off the plane, the pilot announced, he said, "Baby Zach is home." He let me get off the plane first, and everybody on the plane clapped. I still have Zach's Delta wings. They're on a satin heart pillow that I keep on my bed. Rachel was an open adoption. Knowing that birth mother and going on the journey with her during her pregnancy was completely different. Listening to the heartbeat and knowing that heartbeat was going to be mine. There is absolutely no words that can explain that elation. Being in the delivery room and watching the sacrifice that birth mother was enduring. And then the next morning, the birth mother handed me that bundled swaddle of joy, of pureness. She cried. I cried. We cried together. The blanket was wet with tears. Tears of sadness, tears of joy, tears of fear, tears for the future of Rachel. Courage to let go. Courage to assure a better life. And that's the same courage that I began with, the courage to let go. I've never told my personal story. I've told all of y'all about Zach and Rachel. But this isn't about me. This is about women and their personal journey. Sometimes sadness, sometimes tragedy, but sometimes joy. But one thing for sure, because we share one common, unique trait. Women have that inner strength. We have that inner courage. We have that inner resilience. And we have that ability to muster courage when we have to. And I have to tell you, it's taken me a lot to get up here and do this. There are thousands of women in Georgia who possess courage when it comes to the gift of life in their womb. One of them is a woman named Kristen from Madison, Georgia. She was going to come today and sit in the gallery with me. But y'all know what happens. You can't find a babysitter. Kristen first heard her child's heartbeat when she became pregnant with baby Cam 4 years ago. When she offered the chance to listen to Cam's heartbeat and see her photos in utero, Kristen knew her child was a precious life, a gift from God. Sadly, when seeing her doctor 13 weeks later, her child was diagnosed with a rare deformity that produces an abnormal small brain. Kristen was told her baby probably would never make it to birth, let alone live many days outside the womb. But Kristen had faith and courage. She said, "Who am I to say that Cambry couldn't do what any other child can do and live?" And that's what I said about Zach. So she trusted God and rejected every call for an abortion from her friends, from her obstetrician, from her specialist. No one had any hope for a child with microlissencephaly, which is as debilitating as cerebral palsy, but Kristen did. Today, Cambry is not only still with us, but a joy to Kristen's life. They celebrate every day and have with Cam's, despite the fact that she was born with a tiny brain and is physically and developmentally delayed. She is perfect. She is perfect just the way she is, Kristen says. Now that's courage. A mom who heard a heartbeat, was overjoyed with love, and has a special needs child that is making a difference in one couple's life. That, my colleagues, is why we as Georgians are not like New York or Virginia. We will not throw away these children who are not perfect, because all children are perfect in the eyes of God. Kristen, I want to thank you. I know you're watching from home on the live stream, and yes, you are one of those courageous ones giving so much to take care of the child that you love. I want to thank all the women who have taken the time to call or write, and there's been quite a few on both sides of the issue. But let me just start out by saying thank you. Thank you to the police officers that are in the room. I know we have the Georgia State Patrol and we have the Capitol Police. They've been here with us every step of the way this session, and we appreciate you every single day. We had public testimony with 64 individuals entered into the Science and Technology Committee records in a 4.5-hour Senate hearing. It is very much appreciated. Many folks drove a long ways to come to the Capitol for the very first time because I asked them. I didn't ask them to come, they just came. But what I want you to know, and there's people watching out there now in the halls, this is the people's building. It's your beautiful building, and we're glad you came, no matter what side of the aisle that you're on. The Living Infants Fairness and Equality Act provides findings by the General Assembly that the state of Georgia recognizes the benefits of providing full legal recognition of an unborn child above the minimum required federal law. The bill defines that a natural person is any human being, including an unborn child. Detectable human heartbeat is described as the steady and repetitive rhythmic contraction of the heart within the gestational sac. Personally, I know about the heartbeat as a former cardiovascular nurse. I've been in those hospital rooms when the heartbeat stops. Unfortunately, many, many times holding a loved one's hand. Every time it gave me a better appreciation of life and the courage to defend the life of the unborn child. This bill includes 4 exceptions: a medical emergency. If the probable gestational period is at 20 weeks or less, the pregnancy is due to incest or rape, and a police report has been filed alleging the same. Or if a physician determines the pregnancy is medically futile. I've had many people write to me about that question, and that is included in the bill. Medical aid must be rendered to the child if the abortion results in a child capable of sustained life. The bill requires that all abortions be performed by a licensed physician, and any abortion after the first trimester must be performed in a licensed hospital, ambulatory surgical center, or abortion facility. Any woman subject to an abortion where the physician or facility violated these laws can recover for damages in civil action. Affirmative defenses from prosecution for licensed physicians, nurses, pharmacists, and physician assistants providing care which results in accidental or unintentional injury or death of an unborn child. The bill further provides an affirmative defense from prosecution for women that sought an abortion who reasonably believe that abortion was the only way to prevent a medical emergency. The bill provides recovery for direct medical expenses and pregnancy-related expenses from the father. Children in the womb also qualify as a dependent minor for tax purposes. This is much like the tax credit for a live birth. The Life Act also updates something that I'm very proud of, and I talked about this at the beginning of the session. Fortunately, I helped write the Women's Right to Know, and it took us almost a year working with Department of Public Health and then Department of Human Services to be able to formulate and publish this book, and I think it did a great job. It's been handed out to not hundreds but thousands of people. The provisions of the Life Act are effective January 1st, 2020. Y'all excuse me. I would like to address some of the issues that I have repeatedly heard in the last few weeks. First, yes, Georgia is one of the lowest ranking states in the nation for infant and maternal mortality. I only wish the critics that are out there in the hall would work as hard as we have to improve these statistics, like the Senate Health and Human Services and the House Health and Human Services Committee. And also, let's don't forget about Governor Nathan Deal and First Lady Sandra Deal and what they did before they left. Fortunately, now we have a new governor, Brian Kemp, whose mission is also to help Georgia families. Thank goodness for Governor Kemp for your commitment during the campaign. We all say things on the campaign, but now it's boots on the ground, improving infant and maternal mortality rates. In 2016, and some of y'all were here and some of you went with me, the National Conference of State Legislatures, the National Governors Association, the American Academy of Pediatrics, the National Academy of State Health Policy, the Association of Maternal and Child Health Programs, and other groups, I couldn't even write them all down, targeted Georgia and other southern states with equally dismal statistics. We were targeted. We knew we were targeted. We were glad we were targeted. We wanted to improve. We developed a statewide plan, and it was called Improving Quality and Access to Care in Maternal and Child Health. The Department of Public Health, legislators, and various institutions in Georgia participated. We are on a mission. We started that mission years ago, but we're still. And yes, we are making steady improvements in changing our healthcare delivery systems and infrastructure. We've also consistently added, and I purposely have spent the last week, and I want to thank the Senate Budget Office, in the last 5 years, millions of dollars have gone into family, women, and infant health programs. So I went through the budget, and you're welcome. You're welcome. I went through 5 years worth of the budget. And I want you, because there's been so much criticism about this, to understand how much money we've actually put into the budget and how hard we're working. This is just from the 2019 budget. Women's health, family planning programs. I heard from lots of women who said, why don't you put more money into contraceptives and family planning? We put in $15,772,580 in the 2019 budget. Family planning program offers reproductive health care services designed to provide women support with planning, when to have children, reducing unintended pregnancies, determine effective birth control methods, and improving family well-being. Maternal mortality funds, rural birthing facilities for the purpose of implementing perinatal quality care improvement initiatives to improve maternal and neonatal outcomes in Georgia. I'm going to go down the list, and I want you to listen. It's remarkable how much money. Injury prevention, $550,000 in the 2019 budget. This purchases equipment such as child safety seats, bike helmets, smoke detectors, and other things. I can't even read them all. Babies Can't Wait. Everybody's heard about Babies Can't Wait. $24,973,000 provides a coordinated, comprehensive, and integrated system of care for infants and toddlers with special needs, just like that baby we were just talking about. Children medical services, $12,680,003. Families caring for children with special needs care needs. Children's First. Children's First facilitates early identification of at-risk children and links them with early intervention services. And my favorite, because this is what Zach suffered from, autism. In this year's budget, as you know, we have consistently funded autism. $1,614,000. Early identification, screening, diagnosis, early intervention, and family support for children suspected of having or diagnosed with autism spectrum disorder. Home visiting, $11 million. Genetic sickle cell, the minority party always lobbies, and thank goodness you do lobby for that. But $2,661,000, and I put that money in the budget to provide medical genetic services that include evaluation, treatment, and disease management for children diagnosed with heritable disorders. Infant and child oral health, $3,479,000. Perinatal maternal health, $2,194,000. Perinatal services are focused on health of the women and babies before, during, and after birth. And I can tell you one of the best experiences I ever had was going to Albany, Georgia, about 5 years ago, I think it was, and I went to the very first pregnancy centering program in the state of Georgia. We put it in southwest Georgia because we knew that was the highest incident of infant and maternal mortality. And I can tell you that was the pilot program, and guess what? We've expanded that program. It is so successful. I actually went through the program with a group of pregnant women. Regional tertiary care centers, $1,578,000. Comprehensive child health, $9 million. So for the 2019 budget, just this budget alone, $90,896,944,000. But I want to tell you about some other money, and I hate to be talking about money, but this is what the critics kept repeatedly bringing up. We're not doing anything. The OBs that are out in the hall, the senator from Bainbridge from the 11th, he always helps with the OBGYN residency program. Over 5 years, we've put in $1 million for that program. The FQHCs, everybody in this room wants an FQHC in their region. We have expanded them. We have put $3.5 million. Medicaid add-on payment for newborn delivery in rural counties. This is the OBs who said, we can't even turn the lights on. We're going to quit seeing the Medicaid babies. We can't even keep our office doors open. So what did the state do? The state stepped in. And we reimbursed them at a higher rate in these rural counties, and that accounted for $1.3 million. Medicaid reimbursement for evidence-based group perinatal care, $500,000 in 2019. So as you can see, the list goes on and on. I mean, I could have gone into child welfare reform. I could have gone into the literacy program. There's no way. And thank goodness, like I said, Governor Deal and now Brian Kemp, he's stepping up to the plate. We're all elevating these services together. And we need to be very proud of it. We've worked hard, and we're going to work harder. And we are committed to these women with access to care and keeping these babies alive. So, I'm going to show you 5 years. I went back 5 years. In 5 years, it totaled $117 million. The second criticism I've heard was the number of OBs leaving Georgia. Well, let me tell you, the OBs aren't going to rural Georgia. They're not going to rural Georgia. You know, you want to know where the OBs go, and I don't blame them. They go where there's a reimbursement stream. They go to Roswell, they go to Alpharetta, they go to Marietta, they go to Lawrenceville, and they go to Fayetteville, because that's where they get an insurance reimbursement. They do not go down to Dr. Karen Kinzel, who works in Clay County in the 1960s Tasty Freeze. They aren't going down there to help Dr. Kinzel. They're not going down there. And lastly, because I know we're going to go down this rabbit hole. I know we're going. I'm waiting to go down the rabbit hole with you. The Medical Association of Georgia sent out a letter said they opposed this legislation. Let me tell you, they've opposed me on a lot of things. And you know what? By golly, I'm glad they have opposed me on a lot of things, because you know why? I'm standing up for the patient. I'm standing up for the consumer. And if I have to get on top of this building, on top of this gold dome, and dance up and down every day for the consumer, you better believe I'm going to do it. And I have fought them tooth and nail, and so has the senator from Rome, about surprise billing. And everybody in this room knows what surprise billing is. So does it affect me that the Medical Association of Georgia put out this letter? They've put out letters on me before. But it's because I stand up and you stand up for the consumer. And I'm proud to stand with you and to stand collectively. That's a good thing. The other thing they opposed me on, and this is my pet topic, there's over 170,000 nurses in the state of Georgia, 140,000 registered nurses, 32,757 licensed practical nurses, and the nurses that I'm most proud of, the nurses that are handing out those contraceptives in those public health departments. There's 811 RNs in the public health department, 174 LPNs, and most importantly, 133 advanced practice registered nurses that these physicians that put the letter on the desk have held them back because they go to your schools. They go to Augusta, they go to Macon, they go to Mercer, they go to Atlanta, they go to Brenau. I think there's about 13 nursing schools in the state of Georgia. Emory University produces some of the best APRNs, nurse midwives, and they're held back. They're held back by that same group that put that letter on your desk because they don't want to expand their scope of practice. And you talk about access to care, you can talk about access to care all you want. There are nurses out there that will go to work in these rural areas, but guess what? They're held back. They're held back and told not to go there. So we can go down that rabbit hole. We'll go down that rabbit hole, I'm sure, in a few minutes. So I'm going to close out, and I want to tell you there's a few changes. Everybody says they don't like this bill. Some people say they don't like it in the minority party. They don't like this bill. Well, guess what? When this bill came over from the House, guess what? When it came over to the Senate, we're pretty smart cookies over here, aren't we? We refined and we changed the bill, just like we do on multiple bills that come over, and just like the bills that go over, even though sometimes they won't even call our bills up. But we changed the bill. In the Senate Science and Technology, we added definitions and made changes throughout the House-passed version to reflect the detectable human heartbeat standards. The House used the terminology human heartbeat. The committee removed law enforcement agency access because they're going to talk about criminalization, access to health records, and maintains that district attorneys have access to those records. When it came over from the House, it said law enforcement agency. We went back to the existing law and we added just one small term about residing in the county in which it was filed. The committee also added something that I was very proud to change. The word, I believe in the original bill, it talked about child support. I know when I adopted the second child that there was a lot of medical expenses. It wasn't the shelter over the head or the food that you eat. What it was you had to buy perhaps new clothing, your feet may swell, you had to buy new shoes, and that's the whole purpose of that. So with that, I think there was a couple of other minute changes, but with that, Mr. President, if I can just get a Kleenex and clean my glasses just a little bit so I can see better, I'll answer questions.
Senator, you have no questions.
Thank you.